So the PROfound study was one of the key prostate studies presented at ESMO this year. And this is a very important study. It looks at PARP inhibition using a drug called olaparib. And it was compared to a second-line novel hormonal therapy, whether that be enzalutamide or abiraterone, in men with metastatic castration-resistant prostate cancer that had a DNA repair gene defect. And there was a panel of genes that were included. The cohort A, which is the primary cohort, looked at BRCA1, BRCA2, and ATM. And what we saw at ESMO is that in the overall population, but particularly in cohort A, is that there was an overall survival benefit to with the use of olaparib in this population. Now, there are still many questions that have to be answered from PROfound, and in particular, the role of specific, the efficacy of olaparib in specific gene populations still needs to be teased out. It's quite clear, for example, that there's efficacy of olaparib in men with BRCA2 alterations, but in some of the other alterations which were less frequent, it's not as clear that there was a role for olaparib in terms of the efficacy demonstrated. Nevertheless, this is a practice-shaping study that really is the first precision medicine approach in metastatic castration-resistant prostate cancer, and it opens the door to not just other PARP inhibitors being tested in metastatic CRPC, but also now studies that are going on in the earlier disease space with PARP inhibition.